Hello, everyone. I want to welcome you to today's Nursing Home Quality Essentials. And as you're settling in and getting logged on, we ask that you locate your chat button. And if you would, please just enter your name and the organization that you're with. We'd love to see who's joining us today. And we'll just get started here in another minute or so. All right, well, I have straight up 12 noon. So again, just want to say hello to everyone. And if you haven't done so, please put your name into the chat and the organization that you're with. We'd like to see who's joining us today. Just want to say welcome to Tiffany and to Alice. Thank you for putting in your names. I want to again welcome you to our Nursing Home Quality Essentials today. My name is Sarah Friel. I'm a Senior Quality Improvement Facilitator with Telegen, and I'm really excited for our presentation today. We are going to be hearing a sepsis survivor story from Rosie Bartel. But before we get started, I have a few things I'd like to share with you. Telegen has great information to share with you, such as event updates, resources, and tools, and we want to be sure that you're receiving that information. So please add our email, QIConnect@telegen.com, to your trusted list of email contacts. We also ask that you follow us on social media. You can find us both on Facebook and LinkedIn. Another way for you to stay connected is through Telegen's listserv, and this is specific for our nursing home partners, taking into consideration the unique care and services that you provide. If you're not signed up for the listserv, you can do so right here using that QR code. This listserv will provide you with notification of critical updates from Telegen, from CMS, as well as CDC. You will also receive notifications of upcoming events and trainings, such as this one that you're on today. But what's really great about this listserv is that it provides you the opportunity to engage in peer-to-peer sharing. Whether you have a question or you're looking for tools or practices that you can share out with your peers and get their feedback as well. It's a great way to see what others are doing and support each other in that way. I would like to invite you to explore Telegen's assessment dashboard. This dashboard organizes 5 different assessments that can help support you in those areas that you see listed here on the slide. Completing these assessments is a great place for you to start, and then to work with Telegen, who can support you to identify priorities, assess your strengths and weaknesses, and address any identified gaps. Well, we're in September, and September is Sepsis Awareness Month. Now, data tells us that nursing home residents are over 6 times more likely to present to the emergency room with sepsis. So to increase sepsis awareness, Telegen has a weekly email series for the month, sharing best practices, tips, and different resources. So keep your eyes on your inbox, and you can be looking for that. But I do have a question for you. How are you tracking and managing sepsis in your facilities? Certainly, Telegen can help, and you can reach out to us through the QR code there or the email nursinghome@telegen.com. Our presentation today is another way to help increase sepsis awareness. So let's get to it. I am so happy to introduce Rosie to you today. She has a great story to share, which might spur some questions for you. So I want to encourage you, if you do have questions, you can enter them into the chat, and we'll have time and a bit later to answer those questions and give you some opportunities to ask Rosie questions as well. Rosie is a widow. She's a mother, she's a grandmother, and an educator. And in August of 2009, Rosie underwent a total right knee replacement that developed into a MRSA infection and subsequent sepsis. Rosie has experienced sepsis 14 times. Throughout the years, Rosie has battled this infection in her body, but she has not taken this battle laying down. In fact, Rosie is a strong patient advocate. She led a patient advisory group that met with researchers and other stakeholders and did extensive work researching the effect of a patient's environment on infections. She has continued to support the work of this group of researchers by coordinating the advisory group's work with a lead researcher. Now, despite not having a medical background, Rosie acts as a consultant to the University of Wisconsin's Infectious Disease Division. Rosie has a wonderful ability to share her experiences as a patient and to urge researchers and clinicians on how important it is to understand and listen to patients' voices and to look to patients for input in the care that they provide. Rosie's committed to sharing her survivor journey, and I am thrilled that she's joining us today to tell her story. So at this time, I'm going to turn it over to Rosie.
Next slide, please. So I started telling my story, and because of my telling my story, I did receive an award from the Bartel Institute for Patient and Family Innovation in 2022. And that award was given to me at their conference when I also presented about sepsis. Now, sepsis can help strike not only people who have illnesses, but also healthy people. This is my granddaughter who had an ear infection last year, but was undiagnosed or misdiagnosed until she had been to the ER 3 times. And 3 times they had told her to go home. By the 3rd time, she had sepsis. About 40% of all sepsis is developed by children under the age of 5. And many of the deaths that happen with sepsis is children under 5 because they can't tell you what is going on in their body. And if they don't run a temperature, you might not know. This is my friend Karen. She developed environmental sepsis. So she developed an infection from her environment after she had a flood in her home. She lives in Hawaii, and she had a flood in her home. And after she cleaned up the flood material, she developed sepsis, and she lost her legs, and most of her left hand. My reason for doing my research is not my story, but the story of a mother who came to me and said, my 23-year-old daughter lost her life to sepsis after she was told 3 times to go home from the emergency room. From that, I decided to interview patients who survived sepsis or survivors of patients who lost their life to sepsis. And very soon I heard that our stories were the same, that lots of the same things happen. What most people don't understand is that sepsis is a life-threatening condition that arises when the body responds to an infection that starts to injure its own tissues and organs. And it can lead to shock, it can lead to multiple organ and death. Sepsis is one of the leading causes of death and healthcare spending globally. Over 50 million people develop sepsis a year. Over 11 million in the globe die. 1 in 5 worldwide deaths are associated to sepsis. So once I started interviewing patients, I decided to start interviewing healthcare professionals. And very quickly, I learned that healthcare professionals didn't ask their patients what their experience was. What they did was they treated the symptoms. And so when the emergency room or the hospital would call them, they would tell them what to treat them with. Sepsis is the number one way of, is number one in several ways in hospitals. It's number one for deaths in hospitals. It's number one cause of readmissions. and it's the #1 cause for cost to health care. Sepsis also takes place outside of hospitals. I already told you about my friend Karen. I had another friend who was doing gardening for his mother-in-law, scratched his hand and lost his life. Lost his hand. But the one that was most serious was a young man who lost his life because he scratched his leg on a football field and got an infection and lost his life to sepsis. The symptoms are often the same, especially the early symptoms. People start being confused and slurring their speeches. Even people that have dementia might have, and then the symptoms get more serious. They might run a temperature, but many times they don't. Their blood pressure might drop, and so then they might not produce urine, or they might can't breathe properly. And the other thing that happens is that for me, I call it my out of body experience, when I can't focus and I can see myself in the bed, but I can't respond to people. Sepsis is a medical emergency. And by the time you get to those second symptoms, you better be at an ER. Also, sepsis has long-lasting effects. For me, I'm amputated to my waist on my right side. I have developed AFib from sepsis. I have blood issues from sepsis, but I also have some psychological issues. I have a big fear of developing sepsis again. And now, because I lost my husband, I fear more. But there is some hope. Right now, many hospitals are using the 1 hour bundle, hour one bundle. And that bundle gives power to their nursing staff and to their ER staff. For me, I'm telling you, you can't do the hour one bundle at nursing homes, but you definitely can know those early symptoms, that confusion, that fever, that slurred speech. All of your staff should be aware of that, and because the sooner you can get a patient to the ED, the more likely they're going to save their life. You're going to save their lives. 85% of sepsis cases come through the ED, and most of those are often come from a nursing home or a long-term healthcare facility. Now, I think this is a very important topic. I wrote a book, and in my book, I have a whole chapter promoted to save sepsis, because that's how important sepsis and survival of sepsis is to me. Thank you.
Rosie, thank you for sharing that. Such great information that you're sharing with us today. Now, I have several questions, and I, of course, want those who are on the call with us to be able to share questions as well. So we'll keep an eye on the chat. But also, if you want to raise your hand and come off of mute, you can feel free to share that way as well. All right. So I'm going to keep my eye on that chat. But in the meantime, Rosie, you talked a little bit about your own experience. But could you elaborate on that a little bit more, just how this happened and your journey through these 14 years, if you will?
Sure. Now, when I say I experienced sepsis, I probably experienced sepsis more than 14 times, but I was in septic shock 14 times. That meant I ended up in ICU. I was intubated. I usually ended up at least a day or two in a coma, sometimes as long as a week or more in a coma. Many times my family was told I wasn't going to survive, or I was going to survive, but I was going to have either memory loss or lack of function of my kidneys. But why I think I survived was because very early on, my husband started realizing that when I started to go into the sepsis, I would end up not making sense to him. He would say, "Rosie, you're not making sense. You're saying the same thing over and over, and I'm not that kind of a person." Or I would start slurring my speech. Now, I have to tell you that I never run a temperature until I'm in a coma. And so temperature is not my first sign, but my blood pressure dropping really low is what my first is one of my first signs. And when that blood pressure drops is why you start being confused. That's why you are breathless and all those things. So I have a story where I ended up in my infectious disease doctor's office because my husband took me to the infectious disease office and said, I think she has an infection again. You know, let's get her on IV antibiotics right away before she's septic. And so I'm sitting in the office, and all of a sudden I stop talking, and so I'm having what I call my out of body experience, where I can see myself sitting in the wheelchair, but I can't communicate. I can see the people around me, I can hear them, but I can't communicate. And so the doctor looked at my husband and said, "What's happening here?" And he said, "I think she's going into septic shock. Let me throw her in the car and drive her to the hospital quickly," because the hospital was like 5 blocks away. And I remember the infectious disease doctor said to him, "Oh no, we're calling an ambulance." And I'm going with the ambulance to the hospital. And the next day when he came to my room, he said, "You know, this is the first time I've ever seen a patient at that stage. That's the stage that people in the ED see them, but we don't see them that way." He said, we had this protocol where you come to the ED, they might suspect sepsis, and then they take blood cultures, and we wait until those blood cultures come back, and then we make recommendations. He said, "I'm not going to do that anymore. I'm going to now have a protocol for you, and I'm going to make sure that when you show up in the ED, these are the things we're going to do right away, even before we get those results back." And that's why I think I've survived sepsis and septic shock so often, because of the fact that he had the hour one bundle long before there was an hour one bundle. But, even my cardiologist says that now there comes pop-ups on his, if he puts in certain symptoms, there comes up pop-ups that says, "Have you thought about sepsis?" And he said, every time I see one of those pop-ups, I think about you, Rosie, because I know that you were the person who made people start looking at and talking to patients about what their experience is. And, there's a book written by a doctor who ended up with septic shock just because of complications from a maternity childbirth. And it's called In Shock. It was written by a doctor from Henry Ford. And if it's on all of the bestseller lists, and it's a very easy read. Read it, because this is what every patient usually experiences when they have what they call their out of body experiences.
Rosie, I love that story that you talk about your doctor and how he was right there witnessing this happening to you, and his response to that. Now, we do have a question that came up in the chat, Rosie, and it's asking if you can share with us again some of the long-term effects that you're now having because of sepsis.
Well, first of all, I've had 3 amputations of bone and then an amputation of tissue, so that I have all of the tissue removed around my pelvic bone and my tailbone, because I have still got infection in MRSA in my pelvic bone and tailbone. So I was going sepsis, or dealing with sepsis sometimes 2 and 3 times a month. And so we decided to remove the tissue rather than remove the bone, because if I would have removed what I have left of my pelvic bone, I would have had to have reconstructive surgery. So I'm amputated all the way to my waist. I always say I don't even have a belly button, and I sit on my left side because I don't have a butt cheek on my right side. So it's kind of like I have. So that's part of it. Then the other is I developed AFib, and I have to tell you that I was at a conference one day, and when I developed AFib, nobody said it was related to sepsis, but yet all of a sudden one day they said, "Oh, you have AFib," and I'm like, "No, my heart's fine." And they said, "Well, no, it's your electrical system that's bad." But I developed this AFib, and yet I was at a conference where somebody was presenting on sepsis. It was a doctor from England, and he said, many patients develop AFib, and I'm like, nobody told me that was from. And then I also have major blood issues. I have 3 types of rare anemias, and 2 of them cause my white and red blood cells to not mature. So I produce red and white blood cells, but they never grow to maturity. So I have always a low white count and a low red count. When I have a low, when my white count gets to normal, that means I have an infection somewhere. And that's, that's because I know that, and my doctors know that. And I also have a very low platelet count. The other thing is the psychological, and I've been able to deal with it, but yet, there's times when I feel like I might be getting an infection where I'll call my family and say, will somebody come and spend the night with me? Because I don't want to go into septic shock and I'm not aware of it.
Mhm. So it's that, like you said, that fear of just always the unknown, right? And
Right.
you travel a lot
And
with your
one of the, it's kind of like once you have pneumonia, you have more susceptible to it. The same is true with sepsis. Once you've experienced sepsis and survived it, you have better chance of having sepsis again. And so when you are dealing with residents in your nursing homes, remember that if they've already been treated for sepsis once, a bladder infection, an ear infection, a respiratory infection could easily send them into sepsis and septic shock and could kill them easily. Most people don't die from the infection, they die from the sepsis.
Yes. So Rosie, we have another question in chat, and it's asking, how long ago was your sepsis episode, and how long did it take you to heal?
Well, my last sepsis episode was in 2022, but my first sepsis episode was the day that I had my initial surgery, where the next morning, and I didn't know it that I was in sepsis at that point because nobody said that word. But the next morning, when I was told I had a 30% chance of surviving the MRSA, I kept thinking, well, I'm a survivor. I've survived cancer 3 times. I am a survivor. And I thought, what do you know? I mean, this was my infectious disease doctor. I'm like, and that was the first time I met him. But and yet after he left, I couldn't focus on the things that I could have focused on before. I couldn't read a book. I couldn't answer emails. I couldn't. And all of a sudden I realized that I was really sick. And I was sicker than I normally had ever been before.
Yeah.
And so, basically for 15 years, I've dealt with sepsis and shock multiple times and over again,
So I thank you, Rosie, for that. Like I said, you have this battle, but you are a fighter, and that is so evident in your life. Tell us a little, if you will, about some of your current advocacy work and what you're doing to increase sepsis awareness.
Well, so first of all, I do a lot of work with Sepsis Alliance. And then I also do work with lots of patient advocacy groups so that they're aware of what sepsis is. So, that patients weren't told what to look for. I have to say, I was doing a present, and I also do work with Superior Health, which is Minnesota, Wisconsin, and Michigan. They're hospital associations. And so I've done a series with them 1 year, and then last year I did a series for long-term care and dialysis centers for them. And so I want all patients to be aware of, and family members to be aware of what sepsis looks like. And now, I mean, last year on Patient Safety Day, I spent a day at a hospital here in Wisconsin, and that day they put out little cards that explained the symptoms of sepsis and handed it out to patients and that were coming and going and passing our table. So I spent the whole day talking to patients about what to look for in sepsis, and also healthcare professionals. Many healthcare professionals don't understand. One of the things that emergency room a nurse told me one day. She said, you know, when a person comes in with chest pains, we don't think twice about treating them for cardiac, and it might end up being anxiety. But she said, when people come in with, and we think it is sepsis, we have to sometimes battle with the infectious disease doctors or their primary care doctors for them to think it is sepsis, because we don't have, we can't make those decisions. Orders always came from from doctors. And so she said, and it's like sepsis is a dirty word. And she said, it's another symptom of infection. And, and it's the symptom that can kill you. It's the symptoms that can kill you. And she said, that's why we should be treating, fluids and broad spectrum antibiotics will not hurt you if you just, and then if it isn't sepsis, after you get the blood cultures back, it won't kill you, but it will save your life if it is sepsis. And that's what the Hour One bundle is. They give those nurses and ED staff a chance to make decisions without calling doctors.
Rosie, we have time for one more question. And I guess I'd like to just ask, what would you share? What's one of the one things you would share with healthcare providers, even in the nursing home? What could you offer them?
I would offer you that have all of your staff trained in sepsis. And the best, for me, the best way of to train staff is to tell them stories and to share stories. I'm willing to do a webinar with any of your staff on any day to help them understand, or to record a webinar, or to do whatever you need to help them understand what sepsis can do and could cause, but also to tell the stories, because stories help people understand. But it's not just your nursing staff or your CNA staff, but your activity people, your housekeeping people, your dietary people, the person that comes in to do their hair, or the nail, the people that work in the salons, or people that even your chaplains that come to visit. Everyone should be aware of what sepsis is like, because they might see something or in an interaction with a resident that you may not realize is that they're acting differently. Because if they don't have a major medical condition and they're just the resident there, sometimes those interactions with you as an RN or the nurse may not be that great. But yet, it's really, really important that all of your staff understands what sepsis looks like and those early warning signs, because every hour counts in survival of sepsis.
And I agree with you, Rosie. Lived experiences and those stories really do makes quite an impact, as your story has made an impact for us today. And I'm just keeping mind of our time, and I think in our, let me share my screen again here with you. Okay, am I sharing the right screen, Rosie?
You're sharing my book, yeah. So
yes, okay. And you're encourage folks to just take a look at your book and your contact information that you've so generously shared as well.
The only way you can receive my book or order my book is through me, because I have put a personal note in every book that I've either given away or sold, because I just felt like I don't want it something that's out there on Amazon. This is a very personal book. It takes me, it's how I've used my story to improve healthcare.
Very nice. Rosie, thank you so much. I've listed here on the different resources of the information that Rosie has shared with us today. And, if you're like me, you'll probably come up with questions after we close today. So certainly you can feel free to reach out to us. Our emails and contact information is here for you.
I'm always open to people reaching out.
Go ahead, Rosie. I'm sorry.
I'm always open to people reaching out to me.
Excellent. Thank you for that. But as we wrap up today, just want to encourage you to register for some of our upcoming nursing home quality essential sessions. You can see them here. We have a vaccine update coming on September 10th, an introduction to our Telligence 5-star calculation tool. And then on September 17th is our monthly NHSN office hours. And another great event that I want to share with you is coming on September 16th. And this is a webinar from CDC's Division of Healthcare Quality Promotion. And they're going to be sharing some updates with you on respiratory virus season for 2024. So I don't want you to miss out on that. And just, I'm taking a quick look at chat again to make sure that we don't have any other questions. Rosie, I see a lot of thank yous there to you. Just really so grateful for you being here today and sharing your story with us. So thank you everyone for joining us today, and have a great rest of your day.
And thank you, Telligent, for letting me share my story with your people that work in nursing homes. Thank you.
It's been great, Rosie. Thank you so much.